Ask Reddit by Little Fat Buoy. Healthcare professionals, what is a telltale sign a patient has used drugs heavily in their life? 60-year man who had done some drugs in life but was a heavy alcoholic. Never tells DRS of his past. Quit all by age 50. Health is falling apart by age 60. DR does an MRI and showing him pictures explaining the results. She turned to him and asked if he had drank heavy for years. He glares at me thinking I tattled. No. DR shows him the extra space in his skull around his brain, explaining his brain had shrunk from alcohol abuse. I guess you can lie about it, but can't hide it. After a blood draw I was asked if I was a heavy drinker. I absolutely was, but had my shit wired pretty tight at the time, so I asked how they knew. Guy looked me dead in the eyes and says your red blood cells are the size of damn dinner plates. I remember doing phlebotomy rotations at a hospital in the middle of nowhere, Tennessee. Aside from the small 60-bed hospital there was nothing but farmland for miles. I met a patient with heavily scarred, twisted veins. I failed to hit a couple times but eventually found a viable one. IV users can be tough sticks, but what makes me remember him to this day is the forlorn look in his eyes when he softly asked me to be careful because it was his last good one, so please don't blow it. Deleted. 1. Young patient with no teeth. 2. They know very well the dosage of controlled drugs, sometimes even better than you. 3. If they trust you, they will tell you when asked. Or they try to test you. My doctor gave me X amount last time I was here for this same issue, like, well no they didn't, or the doctor should lose their license. Big asshole in the nasal septum with no other explanation for cause. Username checks out. He was smacking his mouth like a fish out of water, wearing a leather jacket in the middle of a hot Texas July. Admitted to coming down after smoking meth. That first sentence is like the beginning to a western crime novel. He can hit his veins better than you. As a newish RN years ago, I was working in the ER trying to get a line in an IV drug user. I missed twice, and after the second try she just sat up and was like, Jesus Christ, give it here, I'll do it myself. NGL, it was funny. When you give them 6 mg of Versed and 300 mcg of fentanyl and they are still talking to you like normal. I've had to cancel a procedure because of this. Got to 5 and 400 and they were still wide awake and could feel everything. Nursing and myself were uncomfortable at those doses and had them reschedule with anesthesia. It's damn hard to get an IV in them in our usual go-to places due to scarring of the veins. They usually tell us where we have to go because that's the only place that still works. I lived with a med student who came home one day and told us about the necrotic penis she'd seen that morning from a user who had collapsed every vein he could find and had resorted to the last one. If they are in recovery they will often use a lot of sugar and caffeine. If currently using they'll spend a lot of time in the bathroom. Hey, I don't use drugs, but I spend a lot of time in the bathroom because of all the caffeine. You can tell by the way that they are. The surprising ones are the closeted grandpas. I worked in the cath lab and an older lady's cath was negative and the doctor told her, then what caused me to have chest pain? Probably your habit, mom. What do you mean? The heroin. Oh. Really? She looked like your average quilting champion. There was a grown motherly type woman ringing up my groceries the other day with track marks all over her arm veins. I was trying not to stare but I really don't see that often. Work in anesthesia, they require 5x the meds to go sleep. I required 4x the regular dose when I had my tonsils out at 16, and I still woke up during the tonsillectomy. Was not doing any drugs. Edit, no, I'm not a redhead, I'm a mousy blonde. My hair bleach is white, not yellow or orange, 0 red tones in my hair. No one in my family on either side going back 3 generations has red hair either. I had a patient once refuse the contrast dye injection as part of an MRI scan because you don't know what's in that stuff. They were there because they were having palpitations following cocaine use. Man, getting that dye injection. I remember the nurse telling me it was gonna feel like I'm peeing, but I'm not. I remember going, okay, yeah, I won't think I'm peeing. That dye went in and immediately I was like, oh shoot, I'm taking a, wait a minute. They look 10-20 years older than their stated age. This one is so true. Took care of a very sick pancreatitis patient in the ICU over the weekend. Dude was in his late 30s and could easily pass for late 50s. Substance abuse treatment nurse here. There are the obvious signs to when someone has or is using, but I personally think about 80% of heavy drug users look like everyday normal people. These people wouldn't turn my head at the store or out on the streets. These people have jobs, have families, have lives outside of drug use. A lot of them have emotional and mental challenges that surpass any physical sign of drug use. Took way too much scrolling to find this comment. People out here thinking they can spot addicts this quickly and easily are delusional because most addicts look like everyone else. I've known tons of addicts, and one of the first things you learn and practice as a functioning addict is how to hide it and blend in. The way they see it is, I'm taking care of myself financially, academically, etc. I can spend my money free time on whatever I want. I think it's interesting to see the playing field with addiction amongst classes. Soccer mom hooked on her kids Adderall. Low income mom does meth. For the same effect as the soccer mom taking Adderall. Because of the class differential, the low income mom is labeled a junkie. I hope I worded that correctly. When they are 25-30 years old and look 50. Recently had a 46-year-old lady on our floor, had no teeth, tons of health issues and looked late 60s. I legit did a cartoonish double take when I saw her age in the chart. I did residency in Phoenix, AZ. One of our nurses frequently referred to the tooth-to-tattoo ratio as a predictor of the amount of methamphetamine use. There was a consistent inverse ratio. TTTR should become a scientifically approved term. It's usually in their charts, but if it's not, Hep C, liver failure, pancreatitis and overall health status and appearance for their age is usually a good giveaway 10/10 pain score, every time you ask. Some erratic behavior is common too. I see a lot of CKD and diabetes in chronic users or patients in recovery after a lifetime of substance abuse. I come from an area with a lot of heroin, coke and alcohol abuse. I've rarely ever had a meth addict and rarely crack users, so this applies mainly to those drugs. I kinda hate the pain score questions. People will always answer differently. I suffer from cluster headaches, and when the doc said how bad is the pain and I said an attack can be between 6/10 to 10/10 depending on the attack. And they didn't take it seriously. I then said that when I broke both the bones in my leg and had to walk on it, I only felt like that pain was a 5 or 6 out of 10. At that point they started taking what I said a lot more seriously. The nasal septum is gone. Either tons of nose spray or white powder. I guess I'll just go back to suffocating for 8 months a year. They tell you, I use drugs. Never forget a patient's history is an important tool. My sister said always be honest. She's a dental assistant, cause she said lidocaine, I think it was, reacts with other drugs. Coke maybe. Not a telltale sign, but a story that might amuse some of the healthcare professionals here. My dad went to the hospital after a bad fall, and they found he had a dislocated knee. So they gave him some painkillers and tried to shift it back into position. He yelped. So they upped the pain meds. He still feels immense pain when they try. Eventually they were like, "Are you a user? This is the maximum dose we can give you." He said no, so they brought in a specialist, who looked at it for about 30 seconds and went, "Yeah, your kneecap is shattered. There's a big shard poking in right here." Oof. He also spent the night before surgery looking up emergency room horror stories, and so ended up writing right leg and wrong leg in Sharpie on his thighs just in case. Apparently the doctors loved that. Usually they are shockingly honest about it. Way more than you think. I work in a family practice clinic and we have a substance abuse screening as a part of the routine check-in. Ask you if you use tobacco, alcohol, or drugs. And patients will regularly confirm that they recently used crack, heroin, weed or whatever. More often than you'd think they would. One of my favorite check-ins, I had a patient whose previous screening said he was using marijuana and meth. And he initially said he wasn't using anything. And I said, "Last time you were here you said you were using meth and marijuana," and he instantly snapped to me and said, "No. I quit using marijuana," and I said, "Well, what about meth?" And he slumped back down and said, "Well, yeah, I do still use meth." Impatience, mood swings, shakiness, many more. Really depends on the substance though. Drugs is an umbrella term for practicality, not for physical chemical similarity. Weed abuse, alcohol abuse, meth abuse, all very different. Put individuality on top of it and it gets harder and harder to make a judgment. People in a significant amount of pain can be impatient and moody. And people with low blood sugar can be shaky. I'm 3 days sober from alcohol, not long I know, and about to kick smoking cigarettes. 3 weeks off chronic weed use. These comments are nightmare fuel to stay sober. Thanks for the wake up call. Scary stuff. Now you have told us we are invested in your recovery. We have your back. 1 hour, 1 day, 1 week, 1 month, 1 year at a time. Truth story. I was starting an IV on a patient and put the tourniquet around their arm. They chuckled and said, "That isn't even close to being tight enough," and proceeded to put one end in their mouth to tie it tighter. 25 going on 70. When you live fast you tend to not leave a very pretty corpse. Addiction knows no bounds. I work as an addiction counselor in medication assisted treatment, methadone, Suboxone, and my clients range from homeless, barely 8th grade educated people to former doctors. That said, addicts are highly impulsive, manipulative and typically aren't the most forward-thinking people due to the nature of addiction. Nearly all survivors of extreme child abuse have a history of substance abuse of some sort, whether it's alcohol or drugs or even disordered eating. The impulsiveness may be a result of extreme childhood trauma rather than drugs. When abuse survivors fix their substance abuse problems, they still face all the work to deal with the trauma that led them to take drugs in the first place. It's really hard for people like this to look ahead and see any future for themselves. They have always been made to feel utterly worthless, even by the very people who are supposed to support them the most, their parents. Happy people don't drown their pain in heroin or whatever. Pill poppers, when they need medications for actual painful circumstances, they don't work or require high doses. To the point where there is nothing you can do, pain tolerance very low and medication doesn't help, but to watch them sit there in pain. I think they do grant some leeway where needed. When I was in and out of the hospital for like 18 months, post-surgery for cancer, my system was able to take higher doses by default. So when I was in and they saw my chart and how broken I was, they were way more willing to get me to where I needed to be medication-wise. Honestly, I feel like most of them are pretty upfront about it. Jaw movement. Before anything else, the loss of control of their lower jaw is a huge red flag of long drug usage. Most of what is telling from just looking at someone can just as easily be caused by other things. Scaring, rapid aging, lost teeth, etc. can all be side effects of chronic illness and poverty. The lifestyle is what makes this worse. Wealthy drug addicts are not as obvious. For example, I know a rich lady who starts her day at 8 AM with wine and coke. You can't tell at all when she is sober that she is wasted most of the time. They are really bad to sedate, show strange behavior at some earlier or later point of their stay, withdrawal. They possibly show more obvious signs of withdrawal. They don't really like it when they get antagonized. They might try and steal meds. They mostly know perfectly fine where and how to get an IV started with them. IQ nurse speaking. You know, I always thought it was weird that my dad acted so out of character when admitted to a hospital for an extended stay. Very irate, rude, and unaccommodating. He recently passed, and when my mom was clearing out his bathroom, she found grocery bags full of prescription meds that he hid from her. She had no idea he was taking so many. Your comment made me wonder if he was withdrawing from something. Deleted. When I'm drilling out old fillings, I usually can smell it. Somehow it permeates composite restorations. Pretty funny. Infective endocarditis, vegetation on the heart valves. The patient needs a lot more anesthesia than the average person. They ask on Reddit what the telltale signs are. Some of the ones I remember during my rotations residency are the obvious track marks, vein abscess, terribly scarred veins, talc retinopathy, terrible teeth, skin, and history of sexual abuse. Or they will just tell you as part of their relevant medical history. Based on the interactions I've had with literally every doctor for the last 20 years, even mentioning chronic pain will make any doctor suspicious of everything you can and assume you're just there to seek drugs. Kinda got an inverted take on this. I'm epileptic and have been homeless due to it. Lack of employment funding. My entire monthly income is only about one stroke to the average rent in Canada today, so my housing is always precarious at best. If you show up in an ER, in Canada anyways, obviously looking homeless and having seizures, especially with anything like track marks, you're automatically a junkie. I've woken up literally chained to my hospital bed, literally surrounded by super angry cops after being unconscious in hospital for literally days on end on more than one occasion due to this. So my take is that at least some of the signs discussed below can be read a lot of ways. For most scans of the brain, that is MRI, there is noticeably less brain matter. About 2 seconds of looking at a scan of a brain, it's easy to tell if someone is a heavy user of certain drugs, that is cocaine, from the small gaps and spacing amongst the brain. Certain vitamin deficiencies. Folate is one example. With even breads and cereals fortified with micronutrients today, it's incredibly difficult to have critically low levels. Heavy alcohol users who essentially drink all their calories develop it though. One time I was having trouble starting an IV on a patient, and she said, "If I can do it, you can do it." That answered a few questions right there. Looks to be in their 40s. I'm 22. When the COVID vaccine first came out, a former friend of mine who is a recovering heroin addict was living in my spare room. She said, "I'm not putting that shit in my body, you don't know what's in that." This same person used to cut their heroin with whatever they could find, including Mountain Dew. I've never done drugs but had a lengthy illness that caused vein scarring from frequent blood draws, and for some reason it takes a lot more of drugs like this to get me out of it. Also, when I had my first kid, we found out I don't respond to morphine. This was after a C-section because of 2 failed inductions. My doctor gave me something much stronger for my second child, which he said was for end-of-life care, so I think it might have been fentanyl. Some of us are just very, very lucky. Had a lady come in for an ultrasound scan of her liver. Her stomach was distended and huge, like she had a huge boulder under her skin. Turns out she was a chronic alcoholic and not pregnant.